Hey everyone, in this video we're going to be talking about what physical therapists do. I'm Dr. Dwayne Scotti. I'm a physical therapist. I'm the founder and owner of Spark Physical Therapy, where we help active adults and athletes get back to the workouts and the sports that they love. So I'm also a physical therapy educator, so I work at Quinnipiac University and help students learn how to become physical therapists. So today's purpose is we're talking career day. Unfortunately, we can't do this in person. I love doing this each and every year at Highland Elementary School. So today I have a special guest with me. Who is here?
Hi, I'm Gabby from Mrs. Gooding's class.
All right, so Gabby is going to help you learn what physical therapy is. So first off, I have a question for you. How many bones do you think you have in your body? How many bones? Think about that. Do you have 5? Do you have 10? Do you have 50? No, you have 206 bones actually. So those are the bones that make up our body. And this is why I got into physical therapy to begin with, is because I was very excited to learn about the human body and the bones that make up the human body. And then we're going to talk about muscles today. So now before we get into certain demonstrations of what I might do as a physical therapist, let's talk first about different areas physical therapists can work in. So the great thing about our profession and going into physical therapy is you can work in a number of different settings. So like myself, I work in an actual gym setting or a clinic. So like when you go to the doctor's office, you're in like a clinic setting. There are physical therapists who actually work at Highland. So they work in schools and help some of you guys out who might benefit from a physical therapist. There are physical therapists who work in people's homes. They actually go visit them in homes. There are physical therapists who work in hospitals, right? So the patients that are in the hospitals, they might need help with getting up and down. They might need help getting stronger so they can be healthy and well again. And that's what physical therapists do. So we work in a number of different areas. So I am personally in kind of a gym outpatient clinic setting. So let me give you an example of something that I may do, all right? So let's have Gabby, let's have you lie on your back, please. So if we look at Gabby's leg, let's say Gabby was playing a sport, right? And she was like playing outside, or maybe she was riding her bike during coronavirus and she hurt her knee, right? So here's your knee joint. So these are the bones that make your knee joint up. So like the bones are like this is like a perfect size for Gabby. So you have your femur bone right here, and that bone connects the hip to the knee. So if we see, the knee is what we call a hinge joint. It bends and straightens. That's what your knee does. So let's say Gabby hurt her knee. She said, I had knee pain, and her dad, who's very smart, he's like, well, you got to go see a physical therapist. So now the physical therapist would take a look at Gabby's knee, we'd look at it, we'd see if it's swollen, and then we'd look at it and see how it does moving, seeing does it move normally. So I might take Gabby's leg and I would bend the knee and see, okay, does it bend as a normal knee should bend, 135 degrees to be exact. And we can measure that. We have these little things that look like protractors. It's called the Goniometer, that we can measure how much the knee bends. So let's say Gabby's knee was painful and it was swollen. She might only bend to here. I could take a measurement of that. And then as I'm working with Gabby, we're getting her better. She's feeling much better. Then I can measure that again and track her progress over time. So now we have the knee that bends. We talked about that. We also have muscles that surround the bone. So what do those muscles look like? So those muscles are like this leg here. So this is showing the muscles of the leg. So there's quad muscles here. Those are your quadricep muscles. And then there's calf muscles here. So what physical therapists do is we test how strong muscles are. So we test on what is the strength of the muscles, because you need strong muscles in order to do things like get out of a chair, like go for a walk, like run, like ride your bike, right? Your muscles are the thing, the engine that kind of, your body's the engine and your muscles are what helps it move, okay? It's like the gasoline in your car. So now let's have you stand up for me, please. So now we're gonna look at Gabby's calf muscle. So Gabby, let's have you hold on to the table here. And I'm going to have you do a releve. So Gabby's a dancer, so she's familiar with this term. I work with a lot of dancers. So go ahead and go on your toe, good, and come back down. And then I'd count how many times Gabby can do this. So go up and down a couple more times. Now it's her calf muscle that's contracting when she does that, when she goes up and down. So Gabby as a dancer should be able to do 25 of those. I'm not going to test her right now, so don't worry about that. We won't test her right now. But if she was weak, let's say she rolled her ankle outside. She was running in the yard and she rolled her ankle. So we call that sprained ankle. Physical therapists take care of sprained ankles. So we can help someone like Gabby who sprained her ankle, and I might test her with this, and maybe she only could do 5 on day 1. And then we work on different exercises to help strengthen her, and then hopefully she's able to do 20 by the time we're done. All right, let me show you one other example of a different type of exercise we might do with someone we're working with. So let's have you stand on this unstable disc here. So I'm going to have you 2 feet on there. And this would be an example of a balance exercise or activity that a physical therapist might work with someone if they want to actually improve someone's ankle stability after an ankle injury, or you might be working with someone who might be a little older who has poor balance and maybe they're falling a lot at home. So think about like your grandparents, maybe they might be a little unsteady on their feet. So physical therapists work with folks to help improve their balance. All right, so we might have Gabby do this. If this was easy for her, I might have her put her arms out and kind of bringing her arms up and down. So now what we're going to do is, besides strength and balance, physical therapists also work on flexibility, and we might help with like stretching. So let me just show you an example of one type of stretch we might do. Let's have you lie on your back. So we can use something like a strap. So there are a lot of different kind of tools and cool things that we use in the physical therapy clinics that will help people be able to either get stronger or get more flexible. So let me have you hold on to this strap here. Here's a simple hamstring stretch. So bend your knee and now kick your leg up until you feel a good little pull on the back of your thigh. So this is stretching the hamstring muscle here. So this might be something that Gabby would want to work on to improve her splits for dance, right? So I hope today's video gives you a little bit of an idea of what physical therapists do. Basically, to summarize, we help people move and do the things that they want to do or need to do within their lives, whether it's in their house, whether it's at their work or in their job, or if it's a sport that they play, or if they want to be a runner. We help them be able to do those things, all right? So I hope this was helpful for you. I'm sorry we didn't get to see you in person. Anything you want to add in there, Gabby, that you can help your friends?
Just hope to see you guys soon.
We hope to see you guys soon. Thank you for watching this. Have a great career day. Bye.